Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and here with me is Dave, rather. Excuse me, Dave. He's an administrative fellow at the Children's Mercy Hospital in Kansas City. Dave, please go ahead and introduce yourself and share a bit about your story.
Yeah, absolutely, man. Thanks for having me, Cole. And like you said, my name is Dave Gardner. I'm currently one of the administrative fellows at Children's Mercy Kansas City. I'm originally from Chicago, Illinois, from the South Side. And then I went ahead and pursued my undergrad degree at University of Missouri, Columbia. I've received a bachelor's in health science with the emphasis in leadership and policy. And I decided to do my graduate school in there as well. And I graduated this in last May with my master's of healthcare administration and my master's of business administration.
It's an impressive career you've already had so far. It's really impressive. And then, what caused you to go from Chicago to the University of Missouri? What interested you in making that move?
Yeah, absolutely. So, I mean, man, it's kind of a funny story. I wanted to be a vet for a very long time, and I went to the University of Missouri because I have a great animal science program, and that was my original major. I was animal science major. I was going to the farm every week. Then I switched over to biology, still wanting to be a vet, and I think it hit me the end of my sophomore year, like, all right, maybe I'm not that good at the applied sciences, and and I might have to figure something else out. So, I had never even heard of healthcare administration. It was always just doctors and nurses is what came to mind as I thought about healthcare and whatnot. So I started doing informational interviews with different people around the Mizzou community, and I interviewed over there at the School of Health Professions. And I mean, it changed everything once I learned about that career path and was able to get involved over there.
Incredible. What did you like about it?
Yeah, yeah, absolutely. So I mean, once I got over there, I became really involved. I was a student ambassador for the School of Health Professions. I was the student lead for the Black Alumni Panel. It just got it very involved in the different work that they had going on, and then it was just such a good support system over there as well. I had a great advisor that was really supportive. And in order to graduate Mizzou's health science program, you have to complete an internship. So that led to me doing my first internship in healthcare, first time working in the hospital and 2021. So that was a great experience. And, I'm really thankful for my mentor that I had throughout that process, really guiding me along and opening that door for me to even experience this.
Wonderful, wonderful. And then that hospital that you were at in your internship or that experience, that was not with children, right?
No, yeah. So that during that time, I was working at the University of Missouri Healthcare. So I completed an internship, and I ended up staying there and working as an intern still. And then I also did my graduate internship there with their director of diversity, equity, and inclusion during summer between my first and second year of grad school. So I definitely I worked there about 3 years. It was a good experience for sure. I made some great connections there, and I feel like I learned a lot. Especially with me entering the healthcare field a little late on my end.
Definitely. But you said that they were really supportive there specifically. What are some things that, they did that really made your experience, worthwhile?
Yeah, absolutely. I mean, just even from the networking standpoint of really being able to get connected with different alumni that graduated and were working in similar roles, whether that was local at MU Healthcare or, I mean, I think a really perfect example is Tommy Thomas was our diversity and equity coordinator for the School of Health Professions, and he connected me with someone that he had went to Mizzou with like years ago, and he actually, City Smith, he actually drove up to Columbia and met with me, sat down and had lunch with me and shared more about his career path. He drove up from Kansas City. So I mean, just that right there was just such a strong show of will, and how much support was in that program, and just people believing in me and helping push me forward. So that was something that I really appreciated. And now that I'm here in Kansas City, me and City connect often, and that's still a great mentor that I have in my corner for sure. So just being supported in that realm and the exposure that I was able to get from different people that I networked with and connected with.
That is excellent, and especially where it was the diversity and inclusion. You said it was the chief diversity officer?
At MU Healthcare, I was working with our director of diversity
Director.
and inclusion.
Excellent.
Yeah.
That's impressive. Because one of the things I've been telling fellowship programs when I meet with them is, you have the C-suite there, and it's usually the CFO and the CEO. But I've been saying what you really need to have is your chief people or your chief diversity officer there, because when people come into a system, they're not always just trying to improve finance. Some people are really trying to improve equity, and
Yeah.
when they don't see that there, it sends up red flags. So that's incredible that they had you tied in with those people so that you could pursue what you're interested in. And I noticed that based on some articles I was reading about you, that you are really interested in pushing health equity forward.
Yeah, yeah, absolutely. I think that's one of the biggest draws for me to be in the healthcare field is the ability to really change things at a systematic level. It feels like, and really help influence the work I'm doing and interfacing with the community, especially just from my background and the things that I grew up, seeing people not health literate at all, not understanding when to take their medication, not being able to afford medication, growing up in a food desert, things like that. I feel like just learning throughout my programs and really understanding the circumstances and the differences and the health outcomes that people face based on their socioeconomic class, their race, ethnicity, things like that. It's things like that that really push me to want to do that work and open those doors for other people and really help improve accessibility to care, health equity, and just work towards overall health justice in general. And I think that was a big draw to Children's Mercy too, because we actually do have a chief equity and inclusion officer, Michelle Wimes, and she's been an excellent mentor to me since I've been at the organization.
And I wanted to ask you about that as well. What was the application process like? How many different, fellowship programs did you apply to? And then what made you choose this one?
Yeah, so I ended up applying to 5 fellowship programs, and I mean, what really drew me to Children's Mercy, I feel like the process with their previous fellow recruiting, I think that was very strong. She really showed the values that they have and exhibited so much kindness throughout the process. That was a big draw for me, and then my own research into the organization as well really pushed me in that direction. I felt like I aligned with the values that the organization had, and creating a world of well-being for all children. I think just that commitment to inclusion and diversity on that end was something that was really strong too. And throughout my interviews, I think it's important too, just for any early careers to think about you're getting interviewed during a job interview, but you're also interviewing the leaders that you'll be working with and the people in that organization to see if you're going to be a good fit because you want to be happy where you are. Fortunately, I made a great decision and I've really been enjoying my fellowship there.
How does living in Kansas City differ from Chicago? Is it are you finding yourself at home there? Do you want to live there long term? Like, what does that look like for you?
Yeah, man, it's surprising. I really like Kansas City. It's a great city for young professionals right now. I feel like it's growing a lot. I mean, 2 back-to-back Super Bowls. It is hosting the World Cup here soon. So I think I've really adjusted well to Kansas City, especially just coming 2 hours away from Columbia. But compared to Chicago, it's a lot smaller in that sense. But I think that that's helpful right now as I establish my career too, because the impact that I'm able to make can be seen a little bit further as you think about that, just size. So I think it's a nice mix between a large city like Chicago and a college town like Columbia. So I've definitely found myself at home here. Moved out here in June, and it's coming up on a year, so I've really been enjoying it.
Excellent. I'm happy to hear that you've been doing well. So you like you said, you're interested in this equity work, and so your experiences growing up in Chicago, like you said, South Side, the food desert that you faced, lots of health literacy and health equity challenges. People know that about Chicago because it's such a big city. It's publicized a lot. Chicago and New York's problems are in the news a lot, but not so much some of these smaller cities. I'm from Charlotte and Raleigh, and people don't always know about kind of the issues of segregation that still goes on to this day in Raleigh. So what is it like in Kansas City? Is there a lot of issues that you're combating there that you're trying to improve there? And if so, what are they?
Yeah, man, that's a great question. I mean, as I think through that and what I've been able to see just through my time here, getting adjusted and integrated into the organization and different projects that we have going on, I think that Children's Mercy is definitely gem in the community, and a lot of the work they're doing, like putting social workers in schools and partnering with different school districts to put mental health care professionals there as well to just start to be proactive, and a lot of different plans we have like that. I think that's something that's really important right now with the youth because it is a it's a mental health crisis right now, and just being a part of an organization that's working hard to address that on so many different fronts. We have plan called Illuminate, and that's been interesting to get to see the kind of the rollout and development of that, and seeing the direction that it's going to shift in. And then other community work as well, just working to be a school friendly health system, a national collaborative that we're a part of with 7 other children's hospitals, and leading an external needs assessment work group to really understand what our parents, teachers, and students need from us as a health system in order to support them in their growth and development. And I mean, just being able to be a part of things like that has been great for sure. And really getting to understand the makeup of the city, the school districts. The redlining was something that was pretty serious out here, just as the city was being developed. So we're looking more into that and learning. I think it's been a great experience getting to learn more about that and be involved in the work, that's addressing those things as well. Just even being inclusive in the research that we do at the Children's Mercy Research Institute.
It sounds like you guys are really integrated with the community there at a deep level. Like you were saying, putting social workers in schools. And for a hospital to be doing that, that's really impressive.
Yeah, yeah. I mean, I definitely that was something that really caught my attention and made me want to go there. And I feel like they talk the talk and they walk the talk as well. Of creating a world of well-being for all children.
That's so important. I want to ask as well. So I've never worked at a children's hospital. Never really had experience with that at all. What has that been like? Has that been like an adjustment? Because it's kind of unique. It's different than, kind of a general hospital.
Yeah, yeah, absolutely. So this is my first time working at a children's hospital as well, and I mean, even when I came for a site visit in last March, it was just like eye opening being inside of the children's hospital and just feeling the energy in there is completely different, and just thinking through the patients that you're serving. They're not choosing to be there. They didn't do this to themselves. So really, just helping defend their potential and help them grow into the amazing people that they're meant to be. So I think that just the energy from the employees in the hospital has been great on the day to day. I feel like people are a lot more connected to their work and really care about what they have going on, whether that's our frontline staff on the clinical end or all the way up to our C-suite. I feel like everybody is really invested in the work, and it's just a great environment to be in. I love the energy going into work every day, getting to see the kids that are there. We have a child life team, and through the fellowship, I did a rotation with that team and got to spend some time with some of the kids and whatnot. So I definitely like the environment, and I see myself staying in pediatrics for sure.
Oh, really? That's awesome. Well, good for
Yeah.
you. That's great. I want to ask, you've done really well. Your resume shows all these great projects you've worked on. What are some tips you have for individuals like myself who, starting off, we're a little bit more, I'm a little bit more shy, not as outgoing, because it seems like you're really outgoing and you're interacting with all these people. So how did you get to that point? What tips do you have for me?
Yeah, man, that's a tough one. It's funny because I think of myself more as an introvert most of the
Oh,
time than
really?
I like to think. But man, I think just really being able to network and sell yourself and really speak to the experiences that you have and how they really translate into whatever it is that you're trying to do. So I think for me, selling my transferable skills was huge because even going into the application and interviews for the fellowship, I didn't have that much hands-on experience, compared to maybe some other applicants. So being able to talk about my soft skills, emotional intelligence, communication skills, things like that. I think sometimes we undermine those things about ourselves, but they're extremely important. I mean, even now in my current role, they help me on a day-to-day basis as I form relationships with my coworkers, leaders in the organization, our community partners. Those things are extremely important too. So as you think about developing your hard skills, you want to make sure that you're developing those skills and, just keep it being a good person in mind. That's definitely a piece of advice. Just be genuine and be yourself. And I think that'll take you really far. And I mean, that's what's worked for me, honestly, because if you're able to show that to people, I think they're more than willing to give you a helping hand and, help you point you in the right direction and whatnot.
Very good advice. Very, very good advice. So how long is this fellowship, by the way? Did you say it was 1 year or 2 years?
Yeah, so our fellowship here at Children's Mercy is a 1 year fellowship, and that's what I wanted to do. I was looking into 1 year fellowships because that was something new to me that I was glad my graduate program really hit on so well. We used to have forums on Wednesdays, and they would talk about fellowships a lot. We had a fellowship panel that I'll actually be sitting on this year, which is going to be interesting to be on the other side of that. But I think that exposure to what a fellowship was really important because you don't fully understand the different job opportunities that may be available to you after you finish that master's program. So I think this has been an excellent opportunity, just getting hands-on experience, really focusing in on different projects, as well as getting to do those rotations through the different departments that we have at the hospital, and really getting to understand how the hospital operates on a day-to-day basis. And from our front lines to time with the C-suite level executives as well, I think that it's really an all-encompassing experience, and it's one of a kind for sure. And I can understand why fellowships are competitive to get because it's a great experience, and I feel like just the growth I've been able to see in myself, both personally and professionally, since starting has been amazing.
Incredible. I definitely am. I haven't done a fellowship. I'm still finishing my MBA, but I'm envious in a way. I like hearing about all these experiences, and I'm excited to be able to do that rotation as well. I've been really heavily considering it. I'm still not sure if I'm going to do it, but everyone I've talked to has just said how incredible it was. So I
Man,
want to ask though, it might be too early. You got 3 months to go, but are there any areas that you're looking at that you're thinking, oh, I would like to, maybe work in this area?
yeah, yeah, absolutely. So I think one area that really sticks out to me, and it's a part of just the overall strategic plan for Children's Mercy. it was focusing on more on community. So we have the Office of Community Impact, and I really think that's somewhere that I would see myself prospering in, just in the sense of really being community facing, being able to engage with the different stakeholders internally and externally with the organization and community, and still being on that operational side as well, and getting to utilize the different skills I learned through my MHA and MBA. Just being able to put those together and really help push the organization in the right direction with the partnerships we formed, organizations we support, and what programs we put to use and where we implement them. I think that that's somewhere that's definitely caught my attention.
I think you're cut out for it based on, your resume and everything. You told me it seems like that'd be a perfect fit for you. So I think you'd do well there.
Man, well, I will definitely keep you updated on that. But I mean, man, Children's Mercy is amazing, and that's another big draw for me is the fellow retention. We have 6 of our previous fellows that work at the hospital, so I mean that was huge. Even during the interview process, the previous fellows help interview in the first round, and then in the second round, it's a more casual coffee chat you'll have with all of them. So I think that was something that really helped draw me in as well. Just seeing okay, people like it here. It's something special about this place, and it's a very strong program. I mean, it started in 1994 and it's been going on for 30 years. So the leadership is really brought into it, and they care about the program and what the fellows do, and the experiences that they get. So it's definitely been something extremely valuable for me.
And then how many fellows are you at the same time or fellows? Just
So
one
I
or
have one co-fellow this year. So periodically we'll take 2 fellows. Next year we'll have 2 fellows as well. So yeah, so it's definitely an interesting experience, and getting to have that collaborative spaces has been nice as well.
that's great. And then who are your preceptors? Is it the C suite or is it who is
Yeah,
it
yeah.
that you
So my direct preceptor is one of our VPs, our VP of Support Services, and
Oh nice.
yeah, so him, and then our COO is our executive sponsor for the program, and then we have another preceptor as well. Justin Bowman, her assistant, is also one of our preceptors, and man, they've just been extremely supportive, and I can't thank them enough on just how they've pushed me to continue to grow. The feedback they've been able to give me just to help me grow as a professional, a person, and really navigate the organization. I mean, I think having preceptors that have been at the organization for quite some time and understand the politics of it, the people to contact and get in touch with, and areas to spend time in. I think that that's made the program all the more valuable. Be where I am today without my mentors and the village that helped make me into who I am. So I think it's very important to be in that space to be able to give back, and that's something that I love doing. Even here in the community, I got involved with Big Brothers Big Sisters. I'm a big, and I sit on their one of their young professionals board. So getting involved in that manner and opening doors for other people as well. I'm the first African American male fellow to go through our program, so I feel like that's just another one of those pieces of saying, okay, like let's break into the field. I think that's important.
I know that I've talked to previous fellows and they said it's challenging when no other fellows have looked like them or no other fellows have been from the same community as they have, and I think it's just so important that we make it something that we value everybody and we show that we value everybody by the decisions we make as an organization. So congratulations on blazing that path for everyone. That's incredible.
Man, thank you. I definitely appreciate it. And like you said, yeah, just creating that space for everybody to feel valued, feel authentically themselves. And I think when an organization is able to do that, then they're going to produce the best results.
Well, I really appreciate you coming on, Dave. Thank you for sharing all of this with us. It's going to really be impactful for our audience. And I just couldn't be more appreciative for you spending your time with me this evening.
Man, I appreciate you, Cole. It was definitely nice getting a chat with you, and I appreciate you taking the time to reach out.
Of course, of course. I hope you have a good rest of your night, and I'm sure you'll probably be getting lots of messages from MHA candidates on this.
Well, I'll be on the lookout.
All right.